At this ASH meeting, we were able to assist to the presentation, the first presentation of the results of the Phase II ELM study regarding the subset of patients with follicular lymphoma, which had to have relapsed refractory disease. These patients were all treated with single-agent Odronextamab, which is a bispecific antibody addressing CD3 and CD20, and which was used in this study as single-agent IV agent. The treatment was used in 131 patients with follicular lymphoma, relapsed refractory. All patients were heavily pretreated with at least the median number of prior lines that was 3, and with most of the patients showing as refractory to both rituximab and chemotherapy, with a significant proportion of patients who receive autologous stem cell transplant. The design was changed during the study, mainly in the step-up dosing phase, with the addition of 1 additional week of intermediate dose for the ramp-up that was implemented in order to mitigate a relatively high risk of CRS observed in the first phase. And at the end, the decision to modify the step-up dosing was revealed to be a safe and effective strategy in order to mitigate and to actually reduce the number of CRS events. In terms of activity, the activity was among the highest, if not the highest, observed compared to other bispecific using the same setting, with a complete response rate that was of 78%, with a very high overall response rate. In terms of efficacy, the median PFS observed in the study was 20.2 months. Thus, this study basically confirms that very important activity of bispecific in the setting of follicular lymphomas, and in particular with Odronextamab, with probably the new benchmark for the definition of activity of this class of agent in this hard-to-treat patient population.